While the administration has been all about jobs this week in the Senate, it's been all about health care. Majority Leader Harry Reid keeping senators working through the weekend as he continues to push for a bill before the end of the year. But why the rush? Republican Senator John Thune of South Dakota joins me now. Senator, what is going on? Why does this have to be done right now?
Well, it seems like what they're trying to do, Charles, is they want to jam it through before people have an opportunity to see what's in this, because I think the more people find out about what it does, the more opposition grows around the country. When you've got a bill literally that grows the size of government by $2.5 trillion, raises taxes on small businesses, cuts Medicare, and raises premiums for most Americans, that's not a very good deal, and most people aren't going to view that as health care reform. And that's why I think they're trying to get this thing behind them as quickly as they can. They just don't want it hanging out there and allowing the American people to see what's really in it and what it could mean for their lives. And I think it's ironic you mentioned they've been talking about jobs this week, and they had the so-called job summit yesterday, and yet everything that they're doing here right now in terms of these federal policies is going to be a jobs killer. All the tax increases that are included in this health care bill are going to be nothing but detrimental to the whole idea of promoting job creation and trying to get the economy expanding and growing again.
So what happens, though? How does the word, all the things that you've just mentioned, how does the general public ever learn about these? I know obviously there's a race against time, but people who oppose this bill in the Senate, how do they get this message out? And can it even do anything right now to prevent passage?
We're doing everything we can in the way of amendments on the floor right now to expose a lot of the problems with this bill. We've been focused the last couple of days on the Medicare cuts and how that would impact senior citizens and health care providers. We're going to be talking very soon about the tax increases and how that would impact small businesses and families, and also about the premium increases. What most people don't realize, because they see this health care debate and they assume, I think, at the end of the day that this is going to lower my health care costs. And what the Congressional Budget Office says, that after spending $2.5 trillion creating 70 new government programs, raising taxes and cutting Medicare, that 90% of the people in this country are going to stay the same or be worse in terms of what they pay for health insurance. And 90% of the people are, the best they can hope for is the status quo. And for a lot of people, it's going to mean higher premiums. So it's not health care reform, and obviously they're doing everything they can to pull a fast one, I think, on the American people. We've got to do everything we can to try and get the message out about what this bill really entails and what it's going to mean, not only for the economy generally, but also for families and small businesses and individuals out there who are going to be facing higher premiums.
Now, from the outside looking in, it feels like a lot of people are for sale. A lot of, to be honest about this, and that perhaps enough deals could be cut that people who have put up some sort of opposition up until this point will be bought off, if you will. Do you think there's one or two people, your colleagues, who are going to continue to oppose this unless there are significant changes to the things that bothered them in the first place?
I hope there are. I think that the Democrats in the Senate are open for business. They're doing everything they can to pick off whatever it takes to get the 60-vote threshold that's necessary to get this bill in the rearview mirror. And what you're seeing right now is these carve-outs for individual states. We've seen it with Florida and New York and Louisiana, and it's like they're going to all these people who have problems with the bill and trying to figure out a way to make those problems go away by offering them all these inducements. And I hope that there are enough people on the Democrat side who will stick to their principles. They know that this bill is not good for health care in this country. It doesn't do anything to affect the problem most Americans care about, and that's the high cost of health care. And ironically, when it's all said and done, it still leaves 24 million Americans without health insurance, which again was one of the stated objectives of health care reform in the first place. So I hope that they will decide that they don't want to see this massive expansion of the federal government, that they don't want to see the higher taxes and the Medicare cuts and all the other bad things that are in this bill, and that all these things that are being attempted to try and persuade them to put aside those principles and come on board, that those will be that they won't be effective.
Well, Senator Thune, if it makes you feel better, I'm working this weekend too. Keep up the good fight.
Okay,
Thanks a lot. Appreciate it.
Thanks, Charles.
Appreciate coming
all right,
on the
you bet.
show.
You too.